If you have had the misfortune to have your mouth wired shut because of an injury, and you have to restrict yourself to a liquid diet, the first few days can be a little overwhelming. I would like to show you some things we learned in the hope that we can help you. For the first few weeks, we fed my wife smoothies. Using the syringe alone is not very practical, but if you attach a catheter to the syringe, it can be snaked to the back of the mouth between the cheek and the gum to about the wisdom teeth. As you can see, we shortened the catheter to a more reasonable length. We fill the syringe without the catheter on, since that's much easier to do it that way. And as you can see, when I'm doing it, I keep a firm grip on the catheter because sometimes you get some back pressure and it'll pop off, which is not a very pleasant experience. The catheter is very narrow and even a tiny piece of fruit will block it. It shouldn't take you long to get a feel for when there is blockage, and the patient will want to wear a bib and place a towel on the lap since there is always some dripping. Now if there is a blockage, you can take the catheter, empty the syringe, reverse the catheter holding it against the syringe, and just pump the syringe a few times and it should clear the blockage. Okay. One thing we realized is that the syringes are made for single use. They're not designed for multiple uses. We did, however, discover a method for reusing it, but you will still want to have a few on hand for backup. At first we had trouble finding more, but we found some at an equine supply store. And this is an example, this is the syringes that we did find. Very important that you clean and disassemble the syringe after use. If you clean it and leave it assembled, it will freeze up and it cannot be used. Also, when you reassemble, use a tiny bit of vegetable oil on the seal of the syringe. Do this immediately before use. The syringe will still have a tendency to stick, so don't wait more than a minute or two before you use it.